Hi everyone, I'm Kristen Scored, physician assistant here at Newport Beach Dermatology and Plastic Surgery, and we're super excited for you to join us for our skin lifting and tightening event featuring our new amazing Sofwave technology. So hang in through the end because we're going to have a Q&A session where you'll be able to submit some questions with the questions tab, and team members will be answering those.
Sofwave is a high-frequency ultrasound tightening device that tightens, lifts, and very powerfully boosts collagen and elastin production. This is absolutely what we want in our skin to help fight signs of aging, including skin laxity and the sagging that happens over time. This is the absolute best skin tightening device on the market. If you want to do anything non-invasively, this is the answer for you. And we brought it into the practice because it's just the top of the line device for skin tightening and lifting. Sofwave is better than other tightening devices, in my opinion, because it truly works. It has no downtime, and it does so. It has a really wonderful safety profile. So Sofwave is going to heat the dermis 1.5 millimeters deep to the skin. That's very, very high in the skin, so that you don't get some of the side effects that you can get of deeper energy-based device treatments. You're protecting the fat layers, the muscle tissue, and the deeper nerves that some of the prior ultrasound tightening devices were affecting. The developers of Sofwave learned that there is a sweet spot, and it's right at that 1.5 millimeter depth in the skin, so that you get all the great tightening and lifting benefits, very powerfully boosting collagen and elastin without the potential side effects that we've seen with prior devices. And it's far more comfortable than some of the other devices. So the discomfort level is very tolerable. I've never had a patient opt out from the treatment, and they really feel that it's, quite tolerable and absolutely worth the results. So a great candidate would be someone who is just in their 20s and wants to prevent the signs of, prevent the laxity that they see with older relatives. And it's also great for patients in their 30s and 40s. We're starting to see the laxity and sort of the changes over time, sort of describing an increase, starting to notice the jowling effects or more loose skin in their neck. So really great. We can also use Sofwave to treat around the eyes to kind of lift the skin and open up the eye. Those are some of the really common treatments that we do with Sofwave. Sofwave is really excellent for both treating and preventing signs of skin aging. So I often will talk about how this is really great for patients of all ages. We usually say age 22 and up. That's who the clinical trials were done on. But I've treated patients in their 20s all the way up to even their hundreds. So really fabulous treatment. You get so many great benefits with absolutely no downtime.
All right, so what can Sofwave treat? It's really designed to help with fine lines and wrinkles, sagging, and tone of the skin. Primarily, we target areas like the brow area, the lower face and submental area, as well as the neck, mostly for concerns in those regions. Sofwave can also help treat various areas of concern on the body for concerns of sagging or lack of tone, mainly areas of the upper arms or above the knees. Those areas could potentially be addressed as well.
There's virtually no downtime with Sofwave, which is just sort of the cherry on the top of this great device. But you'll see results. Most of my patients are seeing results within 1 month of treatment. In fact, when you leave your treatment, you'll actually already see what I call this Sofwave glow. Your skin already looks better. So it's a perfect device to use even before an event. And your results will continue to improve for about 10 months or so. That the induction of collagen and elastin production is peaking between months 3 and 6. So you're really getting that extreme boost of collagen and elastin production in the skin between months 3 and 6, and it continues all the way out to potentially about 10 to 12 months.
Oh, there. We're on live. Didn't these guys kill it? You guys are naturals. I don't know how you answer all those questions and just make it look so easy, but you had it all just nailed. Thank you all for joining us. I really appreciate it. I'm going to introduce everybody. I'm Carrie. I'm the office manager. I don't touch people like I don't treat people. I just boss people around. This is Kristen Squard, one of our amazing physician assistants, and Dr. Blair Murphy Rose. Dr. Rose is in our San Juan office. And Kristen works in both offices, and we can do Sofwave in mostly San Juan, but also Newport sometimes. So let's get started with some of these questions. You guys, I appreciate all of your questions, and I appreciate you all being here today. Wow, we got a lot here. Okay, so how many treatments are needed to see good results on the face?
Yeah.
So who wants to take that one?
I can go. So with one treatment, you will see results. I have yet to have a patient over the last 3 years I've been treating them not notice results with Sofwave. So you should absolutely see results with one treatment. It takes time to get to your full results. Make sure you do wait that full sort of 8 to 10 months to see your complete results, although most patients that I've treated have noticed an improvement within a month. In fact, I have patients come to me all the time and say, hey, 1 month out, 2 months out, I'm noticing something, but my friends are noticing something too. So pretty cool.
I'm not in that peak period yet. I did this treatment with you about a month ago, and I did notice immediate kind of tightening, and I don't know if I noticed a glow. I got some good makeup that maybe is making me glow, but it did do a little something. And so I'm excited to see that end result at 3 months or 6 months. And I think I might be on board to do another one.
Yeah. You definitely could do a second treatment. So if you need a little extra boost, but yeah, it's really exciting because even one treatment could be a great treatment and preventative, just like on a yearly basis.
Next question. Who does this typically benefit most? Preventative or treatment of sagging and lines? Good question.
Yeah, I kind of tailing on that last comment. I would say, I mean, it can benefit both really. It could certainly be a preventative, kind of an anti-aging treatment just in general that you can do and maintain like once a year. Again, the idea is that it's stimulating collagen, which we're always trying to do. And then as far as if you do have concerns like concerns of sagging skin, fine lines and wrinkles, you want a little tone or tightening, then that's certainly a great reason to get Sofwave, and that's exactly what it's for. So if you actually have those concerns, this is a treatment for that. So it's again really good to tackle that concern, plus be something that you can maintenance. It's not invasive, and it's like something that you could do as a routine.
And I truly have treated patients in their 20s all the way up to 101, and it's a really great treatment for so many because you're getting all that great benefit. If we don't do anything, well, let's back up. It's believed that from your 20s on, you're losing about 1% of the collagen and elastin in your skin every year. And the collagen is the major structural protein that keeps everything where we want it to be. And the elastin is that protein that, if you push on your skin, it's going to bounce back if it's nice and rich with elastin. So these are two proteins that we really want. And anything that can boost both collagen and elastin in your skin is going to give you a great benefit in terms of keeping that youthfulness and to your skin. So it's great for anyone and everyone. And then, the downside, why not do it? It really just comes down to the cost and the time of coming in. Otherwise, it's a great procedure for anyone. You will see, if you've got no laxity, in your 20s, super young skin, the treatment is just going to help to ward off those signs of aging that come, in your 30s and 40s. And if you are deeper into this, where you've noticed that skin laxity, or you have, even severe laxity, but you don't want to go the route of necessarily a surgical treatment, or you are doing a surgical treatment, but you want to improve the quality of the skin so you get the very best results overall, it's a great treatment across the board.
That's a good point, because I was like, at my consultation, I was like, I might end up doing a facelift down the road, and does it make sense to do this? And you were like, yes, it makes sense to do it for that reason you just said.
Yeah, absolutely. So with a surgical lift, and of course that's not what we're addressing here, but generally speaking, you're getting rid of some of the tissue and tightening and doing all that. And of course, under anesthesia, under the knife and all that. However, you're not doing anything to the quality of the skin. You are tightening it, but that the quality of the skin, the collagen, the elastin, and the quantities is not being affected at all. So they actually do work very, very well together. You could do just Sofwave and notice the result. You could do, this complements surgical procedure as well. Some of it.
This next question kind of relates to that a little bit. It says, how does this compare to Ellacor? And for those of you who don't know what Ellacor is, you guys can explain that too. Like so one of our people is saying, how does this compare to Ellacor? Ellacor is another procedure that we have here in our office, and it's different in that it's micro coring of the skin. It pulls out like tissue, and then that tissue grows together. And so you lose, in effect, after the treatment, you can see a reduction of excess skin and laxity of up to, I think it's 5 to 10%. Help me out here.
Yeah.
Okay, so that's what Ellacor is. How would you guys say this is different from Ellacor?
You want to take it?
It's definitely Sofwave is considered completely non-invasive, so it doesn't interrupt the surface of the skin. Ellacor, as you described, is a micro-coring device, so you will have some penetration of the actual skin there. So there's more recovery with Ellacor. So there's just differences in that route. But both of them are addressing laxity just in a different way. But again, Sofwave, no downtime, no interruption of the skin barrier. It's non-disruptive in that way. And again, kind of more for the quality of the skin. It stimulates collagen in that way, whereas Ellacor is actually removing skin, kind of helping with heaviness of the skin in that way. So that's how it causes the tightening aspect. So it's a little different angle.
Yeah, good question. And then the question that all of you have been waiting to hear the answer to is, how much does this cost, right? Everybody wants to know how much this costs because we all decided we want it already, right? So let me review that with you. I had to write it down so for the low face, which is exactly how much?
This kind of like includes the upper lip. You go around here, usually sort of just about where the eye hits the eye.
And then none of the
and
neck.
Down to the jawline.
So that's $1,800. And then for the full face, that's $3,500. For the neck, it's $1,500. And for the face and neck, it's $5,000. And then for a brow lift, that's $1,800. How long are results expected to last?
So everyone asks this question, and it's a great question. Well, the results from one treatment of Sofwave are permanent. The stimulation of collagen and elastin that occurs and the contraction of the fibers that occurs when we heat that tissue is essentially permanent. However, unfortunately, we are not yet halting the process of aging. So, it's very possible that you will, certainly you will get new benefits if you were to do another treatment. But I always like to say from the one treatment, you will see permanent effects.
That's a good way to put it. We don't freeze in time like at the age that we do this treatment. We keep aging. So that was a good way to put it. I like this, the way it's stated. So what kind of discomfort are we talking about here? Like, how bad is it?
Yeah, I think it's very tolerable. We do offer topical numbing. I have done the Sofwave procedure. I had it done during our training, actually. And it feels warm, but it kind of feels warm, like it's getting a little hot, and then it just stops like instantly. So there's no lasting discomfort. It's immediately gone. And again, it just feels like in some areas you don't really feel it at all. And some areas you just feel like a little bit of a hot sensation.
And to prep for the procedure, we'll put some numbing cream on that stays on for about an hour. And then during the procedure, we usually will use a cold air that really helps with the discomfort. I have never had a patient in the middle of a treatment say, gosh, this is too much, I have to opt out. With prior devices, that was the case. So you may have heard of some other devices, and patients will say, oh gosh, well, I did that. There's no way I can do another tightening device. This one is very different, very tolerable. Most of my patients are sort of like chatty during the procedure. It doesn't mean you have to be chatty, but you certainly are comfortable. And it's been most frequently described as hot needles, but it's not, as Kristen said, it's hot needles, but the pain doesn't last. We go through these little 6-second intervals. Towards the end of that 6 seconds, you may feel this kind of
intense hot needle pain in some areas where maybe the numbing cream wasn't as, there, or you have more nerves, kind of superficial in the skin. But here and there, intermittent little kind of zings, and that's it. Patients say, so well worth it, and, really not too bad.
That's a really good way to describe it. I'm thinking back to when I had my treatment. It's like fine. Oh, that one sort of was different than the rest of them. Fine. Oh, that one was sort of worse.
But super brief, no lasting pain.
Yeah.
Right.
So, and somebody, I think you discussed this earlier with how the range of ages that you've treated. I think in the video, it might've sounded like it's for people, in the 20s. I think Dr. Rose was saying you can start as early as your 20s and you're going to get that benefit of kind of protecting your skin. And I don't know what's the best way to say it. I don't know. But it's for everybody up until, if you really care how you look when you're 100, God bless you.
Why not?
Why not? So 57 is not too old for this product. Heck no.
Perfect.
Are there any side effects or risks?
I can take that one. So it's a very, very safe device. We're so fortunate to have that, that it really works and it's super safe. We're treating 1.5 millimeters deep into the skin, which is in the upper to mid dermis. And we are, fortunately kind of away from the muscles, the fat tissues. That question comes up a lot. Is this going to destroy? I've heard that this might destroy my fat tissue. We, of course, want to preserve all the fat and the volume in our faces. And Sofwave does not have that effect because it doesn't go so deep. It stays nice and high in the skin. No effects whatsoever on the surface of the skin. So you truly leave with your skin looking just like it was when you came in or better. You get this sort of Sofwave glow up that most patients do see. And none of the redness or the peeling, really virtually no downtime, no swelling. It's like a magic wand, I describe it as.
It's like a little magic eraser. Sort of. Somebody's asking, how is this ultrasound different from other ultrasounds used in diagnostics? This
is high frequency ultrasound, so it's very different. We're not using it to visualize, of course. We're just using it to heat the dermis, the middle layer of the skin, to a targeted temperature that we know leads to an instant coagulation, which will bring fibers closer together and then very powerfully stimulate collagen and elastin production. Doesn't help with any visualizing the skin.
Okay. And then it's somebody's saying they had Morpheus 8 done, which left them with very parched, almost shrunken, and much more wrinkled facial skin. Will this help?
We'll have to see you in person.
Yeah.
Hopefully,
that's too bad.
That is, and that's.
We love Morpheus 8.
Different. Not all devices the same in every user's hand. You want a really qualified provider and someone who knows what they're doing, knows the anatomy very well, knows the device in and out. And so can't say anything about what was done there. And we'd be happy to see you in person to give you a full evaluation. But it has been, it's now received FDA indications for scarring, acne scarring, for work, I believe for cellulite. Ooh. Finding out that it works wonders for all sorts of things. So, it's FDA indicated for a brow lift, jawline lift, submental improvements.
Dang.
All sorts of
I'm lucky things. We have it.
Treatment of wrinkles and fine lines and wrinkles.
Yeah. Somebody's asking for a special event. When would be the best time to be treated?
One of the best things about Sofwave is that you can actually do it right before an event. You can put makeup on right after. You can do your normal skincare routine right after. You can exercise the same day. And you can certainly do it before a special event. And because it actually improves the look of your skin, you could really do it. I have patients who have gone out to big events right after. But if you wanted to reap all of the benefits from it, you would want to do it several months before.
Yeah, so that 3 to 6 months peak, right?
6 months. Yeah.
Yeah, great. Okay, so somebody's saying I'm 70 and African American. Does this cause keloids and does it help hyperpigmentation?
Such a good question.
Great question.
It doesn't have any properties to help with pigmentation concerns, but it is something that is safer for all skin types. So that's what's nice about it is you can be treated safely in terms of like laxity concerns, but it doesn't have a corrective nature for pigmentation concerns specifically. And I'm not aware of it causing keloid issues.
No, yeah, it's exactly. It's safe for all skin tones because we're not affecting the surface.
Right.
We're getting right down deep into the dermis, which is where these high frequency ultrasound waves are targeted. It will not affect the surface, and for that reason, it will have no effect, like you're saying, on hyperpigmentation or causing hypopigmentation, and it is safe for all skin tones.
Mm. Somebody's asking, can you only treat the lower half of the face? Which is, I mean, we discussed the pricing. Yes, you could treat low face, full face, neck, face and neck, brow. And then there's other things that we can treat that I just don't have on the price list that you could, we could treat arms, we could treat like above your knees. Any place you've got some loose kind of, or not loose, but laxity that you're hoping to improve is probably someplace we could treat, and you just have to come in for a consultation to see if you would benefit, and then also what the price would be, because we don't have it all, like our price sheet is not big enough to put prices for everything down on there. So you'd have to come in. How often should you get a treatment?
So again, once a year is mostly what's recommended, but you could do it twice or a couple times if needed. But as Dr. Rose said, we usually want to wait at least that 3 to 6 months to see what your results are, and maybe even longer, up to that 8 to 10 months, because it can continue to get better.
And it just depends what you're treating. So I've had patients who really want to get a very noticeable brow lift, and the FDA studies that we did actually for the indication for a brow lift it was 2 treatments 2 months apart. So and you'll get more benefit. Depends on what your treatment goals are and what your budget is and so forth. You can treat as early as a month after your original treatment. You certainly don't have to, and you will get noticeable results waiting that full period of time. So it depends on
what's your budget. And then somebody's asking about, like, obviously people were listening to the tape at the beginning. They're asking prior devices. We referenced those prior devices, older devices, other ones. What are they, and how are they different? How can they prepare?
Yeah, and the next question, it goes along with that, same sort of thing. So Ulthera was a high frequency ultrasound device that I believe came out in about 2009. That was one of the sort of gold standard treatments for non-invasive skin tightening. Mm-hmm. One of the issues with Ulthera is that the treatment goes deeper. It can go all the way down to a depth of about 4 millimeters. And so there have been reports of patients who have noticed some fat loss from the treatment, much more discomfort, the pain, because you're going deeper, you're getting into some of those larger nerves, and it could have some lasting effects there, and certainly much more uncomfortable. Mm-hmm. So in my opinion, I would say Sofwave is certainly much, much less painful. I have had patients who have been treated with both Ulthera and Sofwave and said, night and day in terms of the discomfort. Absolutely.
Yeah, night and day.
And results with Sofwave tend to be much more uniform and a little bit more consistent.
Okay.
In a good way. And then as far as Morpheus, so Morpheus is a radio frequency microneedling device. So this is using needles that are actually going through the skin, and then the radio frequency creates the heat as opposed to ultrasound, and that heats and stimulates the collagen and elastin in the dermis. So because it's going through the skin, you will have some superficial benefits, and with those benefits, things like improving minimizing the appearance of pores, treating hyperpigmentation. It can improve the texture of the surface of the skin. Those are some of the benefits to it, but then you also get the downtime. You can get redness and peeling and a little bit of swelling in the skin from it. So it depends on what your treatment goal is. If you want to tighten and lift as well as have some improvement of the surface of the skin and hyperpigmentation, then maybe a microneedling tool is the best one for you. But I will say, in terms of, having tried many, many of these devices myself and on many patients, I will say that if firming, tightening, lifting is your goal, Sofwave is by far the one to choose.
We all want that. How long is each treatment? That depends on, which area you're doing, but
I generally say about 30 to 45 minutes if you're doing like a full face or so, plus our numbing time. Mm-hmm. But yes, it depends on how large of an area we're treating.
Mm-hmm. I don't even know what ICD is. I have an ICD. Do we know what that is?
Am
Am I eligible for this treatment?
Yeah.
Yes.
I think it's an intracardiac device, probably.
Okay. Sorry,
What was it?
I don't
Maybe-
know all that stuff. I told you I
tell
don't
them
touch
right
patients.
exactly what it is.
If it's a, what did you
There
call
are a
it?
few contraindications. One of them is active thyroid disease, and but there are minimal, So if you have a specific question and we want to know about your past medical history to make sure you're eligible, just write in.
And then somebody's saying,
call in.
I had this done in November, seeing improvement for sure. Can I just do my eyes again? Yes, you can.
Yeah.
Yes.
A lot of patients choose to do that because they want to get that full face benefit, but also the brow lift or improve the sagging of the skin. I've had patients that have done this treatment in addition to a blepharoplasty, where you're moving a little bit of the tissue above and or below the eye, and it works really, really well as its own treatment or in conjunction with that surgical procedure should you go that route.
Excellent. We covered costs, but I can review it again at the end. You are so beautiful. I love our patients. Don't feel shy about giving us compliments. It's fine. Like you can do that. What does it feel like? I think we discussed that already. How many treatments does one need? And we discussed that. Is this more beneficial on the neck than getting Botox or threads? Thank you for sharing.
Is this one I've been getting?
I was just gonna say, I think overall, when you're talking about, again, the health and the quality of the skin, it's just an added bonus. I mean, it's definitely a way to, again, stimulate your own collagen, which if you're doing Botox, I mean, that helps with the wrinkles and relaxation and that kind of thing, but it's not necessarily speaking to the collagen in your skin. So, I mean, I would say let's do them both, or, at least consider, I think Sofwave is a great treatment consideration for the neck. And then we don't do threads in the office offhand, but the idea behind that is also just, I think, stimulating collagen and helping with, some of those wrinkle concerns, but it's all addressing laxity, which Sofwave does. So I think it's a really good quality treatment in terms of improving the quality of the skin.
And then
Botox in the neck is really great for some of the bands that we see
Yeah.
over time in the musculature, and then Sofwave is addressing the laxity, firming the skin, and improving the overall quality of skin. So for some patients, both of them are really great in conjunction, but they're just treating two different things.
And then somebody's asking, is this better than CO2 laser?
Well, in terms of tightening, I believe it to be better than CO2 laser and with no downtime. But CO2 laser has benefits on the surface of the skin, which so many of us can use, especially if you lived in Southern California. If you've had Southern California years, the hyperpigmentation of the skin, the surface concerns, and so forth. And CO2 laser can address that and tighten the skin as well. So it really comes down to what your treatment goals are, what your downtime, capabilities are like. A lot of patients can't go through, 3 weeks or so of downtime. And then there's different levels of a CO2 laser. So that would be a good question to bring into the office.
Yeah, that would be definitely one that could be discussed at length. There's lots to it. Good question though. How is it different than a water facial with platelets, an H2O facial?
Different. It's going to this is reaching the dermis, and it's going to have more, certainly more effects on tightening, firming, lifting.
Mm-hmm. And then this question, I think, is one I asked you when I got my treatment.
Yeah.
Does it affect filler in the face?
No, in fact, you can do them in the same visit, actually, or, we've had patients who will do filler and do the Sofwave afterwards. It's probably not affecting it at all, depending on where your filler is placed. And this could be another specific question for the provider, but a lot of the times filler is being placed deeper, and the Sofwave is not affecting that whatsoever.
And then somebody's asking about, does it affect Botox, semen, etc.?
No.
Is it safe when pregnant?
We will not. You shouldn't treat when pregnant, and that's just because we don't have the studies for it. You want to address that?
Yeah, I was just going to say the same thing. It's just not a population that's tested, so it's not FDA approved for that population.
Right. Does it work for lip lines, or does that take filler?
You can do both. It depends on your lip lines. It absolutely helps with lip lines. Filler can do that as well. One of the big differences between filler and something like in a Sofwave treatment is that filler will instantly improve the lip lines by filling, loss of volume. And then Sofwave isn't having any effect whatsoever on the volume. And it does take time to see your full results, but it's improving the quality of the skin, building the collagen and elastin, which is the loss of those is sort of one of the root causes of the fine lines to begin with. So they can work really well together. It just depends on your particular anatomy and how your skin looks.
Someone's asking about the before and after pictures we shared. Only one of those, unfortunately, was ours. Like, I was really bad about getting those together. I'm sorry. Anyway, but the gentleman that, we showed the 3 pictures, forward, side, and side. He had only had one treatment, and we saw visible improvement with him. He really looked good.
And our office hasn't had the device for that long to see the full results. Usually we like to show the results at least 3 months out. What was the question? Oh, they wanted to see before and after. But I can tell you this device speaks for itself. I've had years and years of patients who are so happy with the results and always, and often come back for additional treatments on, they saw how good it was for their face, and now they're treating their neck, or they're doing the backs of their hands because they're so happy with the results. So
you're a big reason
we
we
do
brought
have,
this
there's
on.
a lot on the website. The Sofwave website has a lot of results.
Because you were like, I love this. I can't be without it.
Can't live without
right?
it. No,
can I have a consultation and procedure on the same visit?
Yeah, I think that's entirely possible. Absolutely.
Well, I'm going to step in on that one as office manager.
I'm like, yes, let's do it.
So I would say no, only because we would have to block out who's ever schedule that you'd be seeing for this treatment for an extended amount of time. We'd have to have numbing time. Somebody else was asking about saying that blue light was very uncomfortable for them. We do numbing for an hour before the procedure, and then we do the procedure itself can take 30 minutes. So I would recommend you do one of our virtual consultations with one of the providers, have that all squared away, figured out, you're doing low face or whole face or brow lift or whatever you're doing. And then we schedule the appropriate amount of time for you on that treatment. I'm sorry, I didn't mean to.
You're right. You're right.
But is it fair to say that this is a treatment that you don't really necessarily need a consultation for unless you wanted one? If someone were to call in and say, hey, I know I want to do Sofwave on my neck, they could schedule the appointment. Okay.
I don't think people need a consultation, but I would be hesitant to, maybe they have a different expectation, and then we've scheduled, an hour of time, and then they decide not to do it, and then you're sitting doing nothing. So
it's best to make sure it's the right procedure for the right patient. So we can definitely chat with you beforehand.
We have openings for virtual consultations tomorrow afternoon, Thursday, and Friday, so you can get that. Yeah. She's like, that's great for everybody. So okay, maybe for Dr. Rose, you don't have to do it. What is the difference between RF microneedling and this, I guess?
Yeah. Oh, yeah. We touched on this before. So, radio frequency microneedling, like Morpheus, is a device that will have. I mean, the sum of it is that it has both superficial surface effects as well as some tightening and lifting. So, it depends on what your goals are. If you just want to tighten and lift and firm, then Sofwave is the way to go. If you would like to get some tightening and lifting in addition to treating hyperpigmentation or improving this, the texture of the skin, minimizing the appearance of pores, and you're okay with some downtime, then our radio frequency microneedling like Morpheus may be the one for you. Mm-hmm. So if you have specific questions, you can always come in or do a virtual consultation. We can help guide you to the right decision for your skin.
Okay, and we're almost out of questions, so I'm going to just let you guys know we'll be wrapping up soon unless there's more questions. Okay, so if you have more things you'd like to get answered, please type them in. Prices again. So low face is $1,800, full face is $3,500, neck is $1,500, face and neck is $5,000, and the brow lift is $1,800. Somebody's saying, why is it so expensive?
It's a really great device. The device costs money.
I can take this one as an office manager.
That's okay.
My goodness. Okay, so why is it so expensive? number one, the provider's time is very valuable. Number two, the technology is really expensive. Number three, we have to get warranties for all of these things, and there's literally thousands of dollars we spend on warranties, and then there's a consumable part, which I think this is really important to talk about, because sometimes when you're going to like let's say, I don't want to bash anybody, but let's just say you go somewhere and it's like, oh, well, the low face is $1,300 at this place. Are they doing the same number of pulses, or what do you call them with Sofwave? Is it pulses? Mm-hmm. Pulses as what Kristen or Dr. Rose would be doing? Probably not, because those consumables cost the practice or the office that you're going to money. And so if something's underpriced, it could be because of that. The other thing is, I mentioned the provider's time, but also the provider skill level and training and all those things. So that's why it's so expensive. Will I please restate the pricing one last time? Thank you for all being so transparent, truly. Do you guys have any last minute things to add?
I love the treatment. It's
love the
wonderful,
treatment.
And yeah.
It's great.
Like I said during this, I'm so glad we have this. Yay. No downtime. That's so much fun. So you guys, thank you for joining us. As always, really appreciate, you coming out tonight to be with us. I know it's more convenient because you get to sit on your couch or wherever you are, but these things are no fun when nobody watches. So thanks again. And we hope to hear from you. Best of luck, you guys.
Thanks for coming.
Bye.